Hello, this is Dr. Renee Young of Young Naturopathic Center for Wellness. Today I'd like to talk to you about PCOS. PCOS stands for Polycystic Ovarian Syndrome. Polycystic ovarian syndrome is the #1 cause of infertility in women. So it's really interesting to me because at the point that women will come to a doctor who have PCOS for fertility issues, often they've already had the condition for 10, 15, maybe even 20 years. So why is it no one found it previously? Well, it's because PCOS is a combination of things. A syndrome means it can be a number of different things. PCOS includes insulin resistance, and it includes an irregularity of your sex hormones, specifically something called your androgens, which are male hormones. When those hormones increase, it can cause acne, hair loss, abdominal obesity. Essentially, you start to look a little bit like an older man. It is not fun. I have women coming in, they're like, I don't understand what's wrong with me. I think I have this condition or that condition, and it's actually PCOS. And the saddest part about it is, I'm not gonna say it's an easy condition to control, but it's very manageable if it's caught early on. So if you're a woman that suffers from irregular menstrual cycles, specifically if your cycle is lasting more than 35 days, it's kind of a sign of like, hey, you know what? This might be a little bit of a problem for me. If you have increased facial hair, if you have acne, if you have hair loss, if you have weight issues that just don't make sense with your diet, it's very possible that you could have PCOS. Something as high as 1 out of every 10 women of childbearing age suffer from PCOS. So whenever someone says syndrome, I like to kind of give you guys a little picture. One of the syndromes most of us know about is PMS, premenstrual syndrome. So if I told you I have PMS, what would you think? You'd be like, well, Dr. Young, do you cry when you watch TV? I'd go, well, sometimes. Or do you have a body in your car you need buried? PMS is a big deal, right? It can be anything from extreme anger to sadness. PCOS is just as extreme. Polycystic ovarian syndrome can range from a little pudge around your abdomen and a little bit of extra hair, and being Italian, I can be like, well, it could just be because I'm Italian, right? So you might just be chalking it up to maybe your ethnicity or something else, but it can affect women hugely in huge variations. I can have women who are seemingly of appropriate weight, but their percentage body fat is really high, and they have a couple of other aspects of the condition. Or I can have someone come and see me and they have an excess of 70, 80, 90 pounds. They really do have complete male pattern baldness. They have acne. Generally, at the point that someone's gotten to that level, it's caught. So if you're someone that suspects your hormones are off, your periods aren't regular, your weight isn't quite right, bring up PCOS at your next doctor's visit, possibly something that someone can help you with. Your doctor needs to do extensive testing, possibly even take an ultrasound of your ovaries to really figure out if this is a possibility for you. They have to be smart enough to differentiate it between insulin resistance and metabolic syndrome and all those other cool things that you can look at videos on my website. So if you're someone suffering from fertility issues, or you're a woman with irregular periods and you think PCOS could possibly be a problem for you, please give my office a call. You can always schedule a complimentary consultation with our patient care concierge. She can help direct you to one of our fabulous doctors that can help you out with your health conditions. So if you have any questions about PCOS, please post it on our blog, share this with your friends, and we look forward to hearing from you. Till next time, Dr. Young.
Thank you for watching. For more tips and free updates on how you can be well, please download our free special report, The 9 Hidden Reasons You Are Sick, Fat, and Tired, at youngwellnesscenter.com.